How do we treat breast cancer? Now that again depends on the stage of breast cancer. If the patient presents to us with an early stage breast cancer, that means in stage 1 or stage 2, surgery is usually the preferred modality of treatment depending on the type of breast cancer. So for less aggressive or the slow growing ones, which are called as hormone receptor positive breast cancers, surgery upfront is the preferred modality of choice for early stage breast cancers. Now for the aggressive forms of breast cancer, we always prefer chemotherapy or targeted therapy in the pre-op form, and then we ask the patient for surgical excision. Apart from this, when it comes to stage 4 breast cancer, the treatment differs based on the type of breast cancer. As I was mentioning, for hormone receptor positive breast cancer, we treat stage 4 breast cancer patients with hormonal therapy. For HER2 positive breast cancer, we treat them with something called as combination of chemotherapy and targeted therapy. Targeted therapy here, we are specifically targeting the HER2 receptors. And for triple negative breast cancer in stage 4 disease, chemotherapy is the mainstay of treatment. Along with this, recently we are also using immunotherapy agents in combination with chemotherapy for advanced stage triple negative breast cancers. Now we have recent advances in treatment of breast cancer. Depending on the patient's genetic profile, their genetic mutations, we have various other targeted therapy agents such as PARP inhibitors or CDK4/6 inhibitors, so on and so forth. Well, as I was mentioning in the risk factors section, there are certain modifiable risk factors for breast cancer. So having a healthy lifestyle, maintaining a healthy weight in the normal range for that patient's age and height, and consuming fresh fruits, vegetables, avoiding smoking and alcohol, avoiding or reducing the consumption of processed foods, these are some of the ways to prevent breast cancer.